them could not be this great as people believe that we are, because they are the backbone of everything. Tonight we have a plethora of information being shared. Number one, my favorite councilwoman, Felicia Porter from District 10, will be here we'll do a community conversation with her. We have Chesapeake-based Trust, talking about Climate Core programs, Ms. Emily Stransky, and student use of portable electronic device policy, with our Chief of Schools, Dr. Stacy Place-Tosay, Deputy Chief of Schools, Kelvin Moore, Special Assistant to the CEO, Michelle Nelson, Legal Fellow, Caitlin Barnes, and Board Liaison, John Turner, and Ms. Tanae Thurrow will be representing the communications team. And then the PCAB faithful will take it on from there. But without further ado, I want to get started with our councilwoman. So tonight I have the pleasure of speaking with my favorite Baltimore City councilwoman, council member, council person, my favorite one, Felicia Porter. She is councilwoman for District 10. Her and I were members of the Leadership 40th Anniversary Cohort, also known as the best class ever. And Councilwoman Porter's proposal to introduce school-based health centers in Baltimore City Public Schools aims to enhance student health and well-being. So, Councilwoman Porter, welcome to tonight's meeting.
Thank you.
Thank you for joining for this community conversation.
Thank you. And I appreciate you. And it is the best class ever.
The best class ever.
Best
Exactly.
class.
So I'm just going to go into, ask you questions, and we'll have a
Sure.
conversation. And at the end, we'll have try to do it so we have some time so that members of on the meeting can ask questions as well.
Sure.
And this is going out on YouTube Live, and then there'll be a recording, so it'll be put out afterwards as well. The message will keep being pushed from there. So first question, could you elaborate on the primary goals of your proposal to implement the school-based health centers in Baltimore City Public Schools, and what specific health challenges you're aiming to address?
Yeah, so thank you so much, Jason, for allowing me to address your board. I want to back up a little bit because one of the major issues that we're experiencing in Baltimore City, in my purview, is absenteeism. Absenteeism, and as it relates to child health. And so when we're looking at why students are missing school, of course, transportation is an issue. We're talking about food insecurity. But one of the reasons that I introduced the Child Health Equity Act, which is what Jason was referring to, is making sure that we have a mandated approach for Baltimore City Public School students, not just for their wellness checks or vaccinations, but really encompassing all of their preventative health, particularly focusing on asthma, reproductive health, substance abuse, and behavioral health. I'm noticing the data trends as our young people are experiencing not only just issues within the school, but they're also experiencing issues outside of the school as well. And so we know that parents can't take off to take their child to the doctor. And so I want to make sure that schools have a way for our young people to get those wellness checks, those much needed vaccinations, and also any other services like reproductive, substance abuse, and behavioral health right in the schools. Now, we do currently have school-based health centers across Baltimore City. So we currently have many that are across Baltimore City, but what I have found is that they're not as operable throughout Baltimore City. And so what that means is they are not in communities that I feel are needed, and they don't have the necessary resources needed to serve the entire community population. I know there are some issues with COMAR, which school-based health centers are regulated by. And so we are working at the state level to change those COMAR regulations to include multiple screening approach, but also the expansion of school-based health centers, and not just from a school health perspective. That's often what we're hearing, that, if they have a school health suite, then we don't need a school-based health center. And I just don't agree with that. So I'm taking it upon myself and my colleagues to expand the model of school-based health center and providing a city council reporting component to it as well.
Excellent. How many did you say are existing right now?
So we currently have, let me just do the count. We currently have 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 15.
Wow.
Mm-hmm.
15.
Yeah, 15
schools we have.
Yep.
We definitely need them. They are integral to what we are doing. And like you talk about, absenteeism is key.
Yep.
And we know a lot of that is from different illnesses, from not being able to get to the doctor.
Yeah.
So having this as a resource. And I know I was telling you, we had a situation where vaccinations,
Yep.
trying to get them done, and people couldn't get appointments.
Yes.
So
They
that
could,
was a
or they
barrier,
can travel, or they couldn't travel to
or they
um,
couldn't travel.
the required spaces to get vaccinations. And so
Mhm.
this is really creating ease for parents and guardians, so that their child can stay in school and they won't have to miss necessary time from work as well.
Excellent.
Mm.
What do you believe once the bill is, gone through and passed? What would be the proposed timeline for rolling out these centers?
Yeah.
And will there be priority space set for certain schools and neighborhoods?
Yeah, so the timeline that I'm looking at, we introduced it about a month and a half ago. And so, with that being said, we have to go through the current legislative process, and the hearing is going to be on March 12th. And so, after that, I'm assuming that the next fiscal year, which is July 1st, our fiscal year, I assume that we'll have implementation at that point. And the implementation is going to be phased. I understand that there are cost issues related to these school-based health centers. So that is why I've taken it upon myself to utilize our partnership model through the hospitals, through state level commissions, so that you all at the administrator level and the school-based level don't have to have that financial burden within your schools. And so we have set up partners in the community that want to do the work. And they're also able to provide those contract and administrative components on the back end as well, so that we're not only connecting with the parent, but also connecting if that child has a healthcare provider as well.
That is beautiful. You answered one of my other questions. Well, I'm talking about the
Yeah.
funding of it, which
Yeah.
is perfect. So that's key, and that's going to be really helpful. And they have an interest in being in the
Yeah,
community, the hospitals, because they
they
get
do.
federal funding for that. So
That is
this is
correct.
perfectly aligned. I mean,
Yeah.
we already knew you were brilliant, but this makes it even better. So it goes on.
I just can read well.
There you go.
I just
Um, so what kind of services do you believe these health centers? Well, you know what? Let me go back real quick before I ask that.
yeah.
One of the questions that I saw in the chat that is connected to something you just said, the hearing on March 12th.
Yep.
It's open to the public as well, so people can come to the chamber and hear the actual hearing going on. Correct?
That is correct. And we're inviting not only our state level partners, we currently had one hearing already. It was an informational hearing related to school-based health centers. And it was actually really interesting because we invited our state level partners from the Maryland Department of Health to come and share some of the benefits of school-based health centers, the feasibility, but also we do also have some in the pipeline now that are in training programs. So we are working with one in the West Baltimore area that is hopefully going to come online in the next couple of years.
Excellent. Um, so going back to the question I was asking, what are the range of services that
Yeah.
these school-based health centers will be able to offer? So, like when you talk about the difference between the health
Yep.
office that we currently have versus what a school-based health center will is proposed to do for us.
Yeah, so a school health suite can be limited in the respect that when we're talking about actual system level service for the whole child. So when you go to the school nurse, they're usually at a nurse level. And so with the school-based health center, we're bringing in nurse practitioners, physicians, an entire integrated medical team so that any and everything that what that child needs, they can handle within that school-based health facility. So one of the examples that I often bring up, particularly what we're seeing in some of our schools, is our reproductive visits. So we do have some young women and men, those that identify and those that are biologically born, that require services in order for them to, be the young person that they are. So we're talking about pap smears. We're talking about other reproductive services that they would get at a physician, at their primary care provider or their gynecologist. This would be an opportunity for them to have those type of services at the school-based health center. And we've seen that, some young people don't want to go to the doctors with their parents, for whatever reason. I do not think that that should stand in the way of them establishing a healthy lifestyle. And so, wellness visits for women, they can be substance abuse and behavioral health. We are seeing an abnormal amount of young people that are dying from overdose, like quite literally, that are dying from overdose. And so this is an opportunity for mental health therapy, excuse me, mental health therapists, behavioral health therapists, to be within the schools to provide those substance abuse screenings and also connection to care as well.
That is great. That is
Yeah.
perfect. How will the SBACs coordinate with the existing systems that are in place with the health department?
Yeah, so that's why we're using our current partners now and expanding from there. So we do have Baltimore City Public Schools managing a few of the school-based health centers, and then we also have some of the hospitals that are managing these school-based health centers. And we're just expanding their role, their footprint within the current model. So hopefully, we're not necessarily bringing in new partners to the space. So if one area is managed by University of Maryland or I'm sorry, Baltimore Medical Systems, we don't want to recreate that wheel. So we want to have additional school-based health centers or at least some sort of health connection in that footprint so that we're encompassing the entire community as opposed to just the school.
Excellent. Um, so I know that you talk about the parents being involved and the students and the broader community. Um, so two-part question: what are strategies that are going to be in place to make sure that this involvement happens? And
Mhm.
then two, um, will the school-based health centers be specific to the students and families of that school,
Yeah.
or will community also be connected to them? And then we're thinking about like with that thinking thought is like
Yes.
safety, of coming into a school building and all that stuff.
So you hit the nail right on the head. That's one of the barriers currently in the existing law. School-based health centers can only be housed for the young people that attend that particular school. But what we can do is we can begin to host different health clinics outside of the school or in collaboration with community partners that we are not only connecting people to service in the community, but also they're gaining connection with their local school as well. So we're bringing the community into the school, but we're also taking the community outside the school. And I will tell you some of the conversation at the state level is how we can begin to expand that footprint to create an exception for those school-based health centers that want to go out in the community, but that would have to be determined at the state level. So that conversation is happening, but within my jurisdiction, we're trying to say, okay, if you do have school-based health center services, if you want to partner with a faith-based institution that is doing the work in the community, if you want to partner with, for example, Sandtown, we've been talking to them about the Sandtown Collective, how we can bring the entire collective to connect to the school-based health center, even if they don't have a child that doesn't go to that particular school, there needs to be some sort of connection there.
Excellent. That is great. Great news for sure. Um, Beyond the initial implementation, what is the long-term vision for the role of the FBACs in Baltimore's education system and public health landscape?
So my master plan, thinking of a master plan, my master plan
Master plan.
my master plan is to really ensure we have some sort of health and public health initiative throughout the city so that everybody in the city is healthy. The amount of people, families, individual young people that have a chronic disease within the city of Baltimore is alarming. And so we need to think critically. We need to think non-traditionally about how people are accessing our health services. So that can be anything from, school-based health centers like I'm first starting out with, but also it can be the expansion of telemedicine and doulas into the schools as well. Like we just need to think through how the traditional healthcare system has not been able to answer and respond to the chronic illnesses that are existing in Baltimore. And so it's a very large vision. I'm taking it step by step. I understand that, there are funding components, but what we've seen in many of the momentous movements that have happened across history, you got to start with the young people. Because if you start with young people, you create a generational change that is not only transient to the family and the parent, but it is translated to any children or any type of family that that young person would have in the future. And so I'm looking at it from both sides.
That is great. Now,
It's a broad vision.
yes, is needed. And your point is it's support. So hearing what you're saying, we're talking about. We currently have 15 of these in existence right now. They've been working. Um, Being able to broaden that and expand it in different schools, different areas will help us definitely become a stronger and healthier city. We're starting with the young people. It'll
Yep.
it'll it'll affect chronic absenteeism.
Yep.
It'll bring in parent and community support. It'll also help with parent and family engagement, which is something that,
Yes.
as a school leader, we definitely are always looking for. So I am a big supporter. I will do my best to be at the hearing as
Thank you.
well and hope to see as many as my PCAB and as many as my community members at the hearing as well. When you get up and speak, we're going to cheer you on.
And
But
and you
I'd
know,
love to.
and
Yeah, go
and
ahead.
I was just I'm sorry to cut you off. Go ahead,
Yep.
Jason.
No, no, good.
I can't hear you. Would you say,
Go
sir?
ahead. I said you go ahead.
Oh, sorry. My apologies. But like we've had school-based health centers since 1985 in Baltimore City. That was when the first one opened. We are now in 2024. Like if we continue to produce the model of school health, what are we doing to change the future of it? And so this is really an opportunity for us to change the future of health, of public health, in our city, not just for our young people, but for our adults, our older. Like we have so many people. Oh, did I lose Jason? Oh, there you go. We have so many people that are in need of those services. And so just trying to create new ways for everyone to be healthy. If COVID didn't show you nothing, it showed you that.
Excellent. Thank you. My bandwidth is extremely low.
Oh, no worries.
Like I said, I'm working off my phone right now because the internet is down where we are. So, but I thank you, and I want to give opportunity for members to and community members to ask questions while we
Yes.
have our councilman online about this. So, any questions, and if the team can help with the chat and the questions, because I may be in and out, just because of the
And
bandwidth that keeps going
it's so
through.
funny. It's so funny. The example in the chat was KIP Baltimore, and KIP is like the Cadillac of school-based health centers. And what I've been noticing is that there are different models that we can implement in schools that, are intersection between our school health suites and KIP as well. So you're exactly right. It is a perfect example.
Any questions from the crowd? And my conversation was that great
Oh
with
wow.
Councilwoman Porter that he
Don't
just
say
answered everything.
we're gonna go back to BG&E. Look, go back downstairs.
Go.
No, but
Now this is
I really do appreciate the support. And this is a conversation I want to continue to have because I don't know everything. I know I don't know everything. And so if there's an opportunity that you all see that we're not including, that we could include to make the process and quite frankly the model that much better, like I lend my ear to you all. So Jason knows me very well. I have a very open door policy. But I want to make this a collaborative process to make sure that we're all speaking the same sheet of music, but that I'm taking into account any barriers that I may not be thinking of.
I have one question, Council,
Sure.
before you leave.
Yeah,
Um,
no worries.
so would the students be able to seek treatment by themselves, or how does that work? So I know
So
you said
yeah.
sometimes they don't want their parents in the room, and I just remember a young man, he hurt his foot during lacrosse, and I was trying to take him to urgent care
Yes.
because he said his mom just didn't take him. Like, you can't play a sport and be recruited to play in college if you don't get your body parts looked at. So
Yeah.
how does that work? Like, can they seek treatment on their own, or?
So it's an age level. So
Okay.
it's an age requirement. So I believe in the state of Maryland, the age is 16.
Okay.
16. but I could be wrong about that. But I do know that there is an age requirement. I do know for any type of like reproductive or gynecological exams, there's also a consent requirement, a consent for age requirement as well.
Okay.
Yeah, so I can definitely get back to you on that, what that age is, but I'm pretty sure that we would still have to follow the law in relation to that. Yeah.
Okay. Yeah, because having something at the school, like, it might be easy for his parent to get to the school,
Yes.
help him get some, treatment. And
That-
it just brings back, like you said, a lot of chronic illnesses. I remember my son in elementary school. I asked him why was he going to the nurse all the time, and he said he was a buddy to a young
Mhm.
student who had diabetes, and she had to go to the nurse to get her insulin. So
Wow.
he was her walking buddy, and he would go with her every day to the nurse's office. So I was like, oh wow, that's like interesting.
Yeah. Wow, that is interesting. But I love to see it happen though, because what you just described is that peer-to-peer model um, of healthcare. And your son at that young age knew to walk, his friend to the nurse's office. So that's pretty cool too.
Yeah, so it kind of helped him because I was like, do you know why you're taking her? And she's like, yeah.
Mhm.
He said, yeah, she has to take medicine, and I
Yeah.
walk with her in case something happens to her.
Wow. Wow. That's pretty cool. Is that like that in every school?
I don't know. This was at North Bend Elementary Middle,
Okay.
and he was her buddy. That's what he said. He was her buddy.
Okay. Wow.
That is great. But I want to thank you again for your time. I know you are extremely busy, and we are excited to have you share this. And whatever we can do as PCAB to support this effort, please let us know. And not wearing my PCAB hat, not wearing my new song hat, whatever we can do a new song to be on that list or to support you in any way, definitely let me know, because
Oh, no, it's
I
a
will
few.
be out there beating the path for you as well, because this is
No, it's a few.
really important and it's huge.
Few.
So
Corey, we gonna come to your school. We gonna come back to your school again.
there you go.
Jay, I mean, so it's we gonna no, it's a few of y'all on here that I see today. We just about to get
Yeah.
everybody. So
Well,
Dr.
thank
Ryan,
you again
Dr.
for
Ryan,
your time,
everybody.
for sure. And you have a great night. Next up, we have Chesapeake Bay Trust with Emily Stransky, and I am going to be passing this on to my amazing Vice Chair, Shartae. She is going to run the meeting for us. And Emily, good seeing you again. It's been a few years since I've seen you in my new song role. We met before. But thank you all for your time and effort this evening and being a part of this. This is great. So thank you all.
Thank you so much for having me. Am I able to share my screen? I haven't tried. Let me see. Oh,
You should be able to let me know if you can't see it.
okay. Let's see. Hopefully I pick the right one here. Let's try this. Okay, and all right. Do you just see my PowerPoint or do you see my presenter view?
We see your PowerPoint.
Okay, great. Thank you all so much for having me. I'm Emily Stransky. I'm a program manager at the Chesapeake Bay Trust, and I manage our workforce development, workforce development and environmental literacy subdivision. So I'm here to talk about our Climate Corps programs that has an application open right now. And I just want to preface with, my husband's putting my baby down for bed, and my 5-year-old is wandering about. So there is a less or more than 0% chance I will be interrupted at some point during this. So just putting that out there, I apologize in advance when she busts into my office. But that is life. So yeah, the Chesapeake Bay Trust, we manage 2 different Climate Corps programs currently. However, they are one application process. So I'm going to go over both of them in detail so that you have all the information, and but just know that they are one application, but kind of 2 different programs with a little bit of a different audience and a little bit of a different content. So you'll see what I mean as I go through here. And let me just check the time. Okay, great. Okay, so the Chesapeake Bay Trust. So we are a nonprofit grant-making organization, and we were actually created by the Maryland General Assembly. So we're a quasi-state entity, but we're a nonprofit. So it's an interesting relationship there. But our goal is to really increase stewardship through grant programs, special initiatives, and partnerships. And we focus on K through 12 education, on-the-ground restoration, community engagement, and the science of those different realms. And the Chesapeake Conservation and Climate Corps program, as well as our Maryland Climate Corps program, is one of the initiatives, special initiatives that we work on. And the trust, our general funds actually comes from the Chesapeake Bay license plate. So if you've seen the Chesapeake Bay license plate around or you have one, thank you so much for having one. Those funds actually come to the Chesapeake Bay Trust, and we use that funding to make grants to community organizations, county agencies, different nonprofits. And it also helps, fund our core programs as well. We also have a lot of different partnerships with federal agencies, state agencies, county, city governments, towns. We have a tax checkoff, and if you purchase a hunting and fishing and boater registration, you can actually donate to the trust as well. So just a little bit about the Chesapeake Bay Trust. And as I said, we manage two kind of zip together core programs. And the first one I'm going to talk about is the Chesapeake Conservation and Climate Corps program. And the application that's open right now is for the 2025 to 2026 cohort. They're a year-long cohort, and I'll go into a little bit about that in a few minutes. But the program was actually started through also legislation in 2010. So we're in our 15th year of the program, and it's meant to be a green jobs workforce development program. Members who participate are stipend supported, so they receive a stipend for participating in the year-long program. And it's really a service program. Then they serve from August to August every year, where they're placed at host sites, which are nonprofits and government agencies in the state of Maryland. And we call those our host organizations. So this is an individual placement program where core members are working at a host site, but the trust is administering the program in general. And I'll get into a few details about what the trust does. There's not a lot of program eligibility for this program. We do have an age requirement. Members need to be 18 to 25 at the start of the program. So this is a great opportunity for graduating seniors who will be turning 18 by August to be in the program. It's also great for college graduates who are ending their college career and looking to start fresh, start something where they get their foot in the door. So we've seen folks use this as kind of a gap year between high school and college, or as an opportunity to maybe they're graduating high school and they're not sure what they want to do next. This is a great opportunity to see if maybe the environmental world is the place for them. And the only other eligibility is that they are able to work in the United States. So just an age requirement and able to work in the United States. So in 2010, the program started, as I mentioned, and then through the 2022 Climate Solution Now Act that the state of Maryland passed, we were able to receive additional funding that allowed us to really expand the program, increase the number of placements, really focus on climate issues, and also really making sure that we're serving communities disproportionately impacted by climate change. So those communities who are on the front line and fence line of climate change. And we changed the name of the program to add the "and Climate Corps." So I already mentioned member eligibility. For the Chesapeake Conservation and Climate Corps program, the stipend is $33,280. That's the equivalent of $16 an hour, and folks get that disbursement in chunks every other week. So it's similar to getting a paycheck. They get paid every other week, and the stipends dispersed that way. As I mentioned, the program is August to August. And this year we started with 54 core members. We anticipate around the same 50-ish core members for next year, for the 2025-26 year. So this is just a little bit of a snapshot of the program. Core members gain real-world experience because they serve full-time with an organization for their year of service. So they're actually working in an office, out in the field, and they really get the experience of what it looks like to serve with an organization and what it might look like if they worked for that organization in the future. As I mentioned, we anticipate around 50 members being placed. We are happy to have expanded the program this year to include health coverage for folks who don't have coverage through a parent or guardian already. So we're able to provide that during their year of service. We provide different professional development trainings throughout. I'll go into a little bit more about that. Members also do project days with their whole cohort. So typically each member is at a different host site, but we bring the members together during the trainings throughout the year as well with project days so that they can really get to know each other. We also encourage, and in some cases require, core members to actually go to different host sites to do site visits so they get an idea about what other core members are working on. They get to meet different mentors. They get to learn about different organizations and maybe do something hands-on that they're not doing at their regular host site. So just as an example, and I'll go into this a little bit more, but I was actually in the core program in 2012. I'm an alumni of the program myself, and I was working at a nature center, and I was doing a lot of environmental education. So I was going out on canoe rides and working in the garden and, like wading into the stream with kiddos. And I did some site visits where I got to go down to an island and do bird nest surveys, which was pretty cool. And it was something that I didn't normally get to work on. Members complete a capstone project. They have an opportunity to apply for a grant, so they get a little experience there. We also fund them to attend a professional conference. And then, of course, they get mentorship from their host mentor at their site. So just going into a little bit more about the real world experience. Like I said, they're serving full-time at a host organization. And if anybody that is interested in this program, we actually have the full list of potential host sites already worked out because the hosts have already applied. They applied in December, and that way we know who might want to be a host site, and the members who are looking to apply can look at that list and see if anything interests them. And we received over 100 host site applicants. So there's a lot of different types of organizations. They range from really small community organizations to organizations who aren't doing any type of environmental work other than maybe this one niche thing. So we have like faith-based organizations. That's not their main mission, environmental work, but they have an environmental component that they would like a core member to help with. So we have community organizations who aren't typically tied into environmental work. We have organizations like state government entities, county government entities, even some federal agencies. We also have a lot of different environmental nonprofits, and they range in size from small to large. And the unique thing about this is that although the host site itself doesn't need to be an environmental organization, they do need to be having interest in doing an activity in the field of either climate change, environmental restoration, energy conservation, sustainable agriculture, forestry, community engagement, or K through 12 education, pre-K through 12 education. And so those are the things that their core member would work on throughout their year of service. Each host site is required to have a specific mentor for their core member to really help them make sure their projects are progressing, come up with their work plan that they'll be working on, and also really help them figure out what their next step would be after the core program. So what do they want to do next? Help them make connections and find opportunities to help increase the impact of their resume and their skills, and really set them up for success in their next step. Just to go into a little bit about the capstone project. So each core member is required to do a capstone project as part of their work plan during their service year. And this capstone project, we really like to call kind of like a legacy project. It's something that the core member works on that they can use as an example of the work that they did. And this is really helpful to be able to put on a resume or talk about in a cover letter if they are interested in applying to another full-time job after their service year. And, it's just to showcase their experience and skills. We've seen lots of folks use it when applying to grad school or college applications if they're a high school graduate. And it's just a really great opportunity to have a nice kind of big project that they're really proud of. Core members also have the opportunity, it's not a requirement, but they have the opportunity to apply for what we call a mini grant through the trust. And this can help them fund their capstone project. This can help them fund another project that they're working on at their host organization. And it gives them that grant writing experience, budgeting experience, project management experience. And it's helpful. here's my little one. It is helpful for the host site too, because they get a little extra money that they don't have to take out of their budget. Hi, do you need something? No, okay. And yeah, if you work in the nonprofit field or the education field, you know that a lot of times grants are a necessary component of the work that we do. And so this gives them that kind of first step experience in that. So just an example, one of our core members from 2 years ago, 2 years ago, Jamal was at Chesapeake Conservancy, and his capstone project was to create a docuseries to showcase conservation success stories in the Chesapeake Bay watershed. And so he put together this awesome video. He applied to the mini grant to get the equipment to do that and the supplies and materials. So that's on here. I'll share this presentation out, and you would be able to watch that video if you'd like. So just to go into a little bit about the trainings. So we host a series of trainings for the core members, and they are really to increase knowledge and skills in not only topics in the environmental field, but really to help their professional careers as well. And so those really range from virtual trainings to one-day in-person trainings to overnight retreats as well. And we focus on climate change, emotional intelligence, giving and receiving feedback, self-care, leadership, financial literacy, diversity, equity, inclusion, and justice, professional development like resume and cover letter writing, interview skills, how to look for a job, how to apply to a job, and environmental education. And then, like I mentioned, we have some networking opportunities, and we found that one really wonderful thing about the core program is the cohort that is built between those, 50-ish core members and the relationships that they build there that they're able to take forward. So there's those project days that I was mentioning, and there's those project days I was mentioning. We have 4 a year where they get together and work on a project, and that project is led by a fellow core member. They have site visits, which I mentioned, and then we also provide funding for each core member to go to a professional conference, typically of their choosing, if they are interested in a special topic that they want to learn more about. And just, I think she really wants everybody to see her. Just for the Chesapeake Conservation and Climate Corps, here's some statistics. So we're in the 15th year of the program, and we have over 400 graduates, of which I am one. And those folks, a lot of them have been hired by their host site to continue their work at their host site. Many of them go on to graduate school or university or college, or they stick in the environmental field, maybe at a different organization. But many of them are in the Chesapeake Bay region still, which is wonderful. Okay, just really quick, I'll mention that the application deadline is March 6th. And what happens is folks who are interested apply to the program by March 6th. And then we go through the applications and we review the applications we receive. A subset of folks are then invited back or invited to move forward in the process. And during the next phase, they are able to connect with the host site applicants and figure out where they might want to be placed. And so we have about 2 months where applicants of hosts and applicants of members are speaking to each other to figure out, who would you want to be placed with, where would I want to be placed at. And then at the end of those 2 months, members and hosts submit to us a ranking form where they say who they'd want to be matched with. And then we do a lot of lining folks up to see, who would want to be placed where and how can we make the best matches. And typically we have that done by early July, and folks start in August. The application package is here. I'll drop the link in the chat when I'm all done so that you have access to that. And like I said, all the potential host descriptions and organizations are, we have a unicorn joining now, are listed on the website. Okay, so that is the Chesapeake Conservation and Climate Corps program. And I want to tell you a little bit about them. a little bit about the Maryland Climate Corps program. So this is another program that we are managing, and the application package, like I said, is zipped together. So it's the same application process, but just a little bit of a different audience and background. So this program is in partnership with the Maryland Department of Service and Civic Innovation. And just as a background, if you're not familiar, Governor Moore has the SERVE Act that was initiated, and that is supporting the Maryland Corps and the service year option. And Maryland Climate Corps is a branch of the service year option. So we are currently in our first year of assisting Department of Service and Civic Innovation in administering the Maryland Climate Corps under service year option. And for Maryland Climate Corps, it's a slightly different eligibility. So still need to be at least 18 at the start of the program, which will be in September. So it starts just about a month later than the Chesapeake Conservation and Climate Corps program. And the difference between these two programs is really that you are required to be a graduate from a Maryland high school within the last 3 years. So they're looking for new graduates from high school. And the program is similar. It's a full-time commitment, but it's only 9.5 months instead of 12. So a little bit of a shorter service term there. The stipend is the equivalent of $15 an hour, about $600 a week. And it's one difference of the program is that folks who actually finish their service term of 9.5 months, they receive a $6,000 completion award at the end of the service term. And so they're typically encouraged to try to put that into a 529 so that they can use that for education in the future. But it's not necessarily a requirement. Always good though, to kind of start that pot of funds there. I don't think I have anything else to add in this one. So generally, a lot of the other components of the program are similar. The young adults are placed at host sites. They focus on environmental projects. They get that real world experience serving at an organization. We will be placing about 40 fellows. So between the two programs, we have about 90 spots, which is wonderful. I mentioned the stipend and the completion award. We do similar trainings in the two programs. We actually just had our diversity, equity, inclusion, and justice training yesterday. We have an environmental leadership training coming up in March, which is actually an overnight. So very similar trainings that I've already gone over for the Chesapeake Conservation and Climate Corps. In addition, for the Maryland Climate Corps, the fellows are able to attend the service year option trainings that Department of Service and Civic Innovation is putting on for the whole service year option, which is hundreds of members. And so those focus on a lot of professional development opportunities as well. And the only other slide I have here, because most things are very similar between these programs, I will just add that one cool thing about Maryland Climate Corps is they are utilizing a platform called Build Within. And Build Within is an online training platform. And fellows can earn an apprenticeship credential through the Department of Labor when they complete their work through that platform. So that is something really cool that they're able to take forward with them. And so both of those programs, as I mentioned, it's one application process through the trust this year. Folks, when they go to apply, they can select which program they're interested in so that we know that on the back end. They can view the hosts who are interested in both of those programs on our website. These two contacts here are for the Maryland Climate Corps, but I'll drop my email in the chat as well as the website where you can access all this. And that is all I have. I'm happy to take any questions. And like I said, I can share this PowerPoint if you all want to forward it along to participants. But in general, it's a great program. I've enjoyed being alumni and enjoy being able to manage the program now. And yeah, a lot of great alumni that we have who are doing really cool things in the environmental field. And something that I really appreciate about the program is you can really get your foot in the door. You know, a lot of people are hired on by their host site full time. And some folks even, and this is still a good thing, they decide, I don't really like being outside. And so they decide that the environmental world's not the place for them, and that is totally okay. I would say that's a smaller portion of folks, but it is an opportunity just to, test the waters and see if it's something that you'd want to do. So, oh, you got an email on the program today. Yay, thank you. Yes, and so I assume, Charlene, that you were talking about the placement process. So we really try to give member applicants the opportunity to be choosing where they want to go and what their interests are. We cannot place everybody who applies. Last year for just the Chesapeake Conservation and Climate Corps program, we received 145 applications and we had 54 spots. So we weren't able to place everybody. So, but we try to make sure that the folks who are placed are getting the organizations and positions that they'd really like to be in. So that's all for me.
Hey, this is Corey. I believe this is an amazing program. As if we could say like 13 to 17, even 18, we call that wonder years, but I consider 18 to 24 like really testing years. And so you got to capture young people at that moment, because especially in Baltimore, because we don't want them to go wayward. That said, what could we as a PCAB, as a community, do to, try to get more than 54 slots? What can we do to go and advocate for you all?
Yeah, thank you. I appreciate that. So the majority of our budget is through the state of Maryland, and we've been very lucky to receive funding from them. We are always looking for opportunities to expand. So we do have a partnership with BG&E as well. But I'd say if you know any organizations who are looking to help fund workforce development programs, send them our way. We'd love to. One thing I'll say is the Chesapeake Bay Trust our specialty is zipping funds together. So a lot of our grant programs have multiple funding sources coming in, and then we are zipping them together, kind of leveraging those funds to really expand the impact of the programs. So that is something that we specialize in. So yeah, if you have organizations who are really interested in funding this type of work, but maybe don't have the platform to do it, we're a great opportunity to do that. But otherwise, yeah, I mean, if you are talking to folks and want to encourage, the state budget to fund us every year, then that's wonderful too. But we are really lucky. We have a lot of support. And yeah, I think that's probably my answer. We've expanded exponentially in the last 2 years. We did have about 30 members two or 3 years ago. And after the Climate Solution Now Act passed, we were able to expand by over 20 more members. So just in the past couple of years, we've expanded quite a bit. So hopefully that's a good sign that we'll continue to expand as well. Yeah, thank you.
All right, that was great. Thank you for your presentation. If you don't mind, can you share your slides with us so we can post it on our website when we share what we have going on tonight? So thank you.
Absolutely. Yep. Thank you so much for having me.
Yeah. So next we have a presentation on the student use of portable electronic devices. We have several members from the district office here to present and talk about that. So whenever y'all are ready, feel free.
Hi, good evening. So while we are getting set up right now, I just want to introduce the team. My name is Dr. Stacy Place-Tose. I'm the chief of schools, and I'm joined by several members of the team. And although everyone is not here, I would like to say that this is a huge task and a collective effort across multiple offices. So with this evening, we have Jonathan Turner, who's our board liaison. We have Caitlin Barnes, a legal fellow. We have Cora Parsons, she's my special assistant. We have presenting for you this evening, Seema Shaw Nelson, who is the special assistant to Dr. Santelises, and we have Kelvin Moore, who is the deputy chief of schools. So we look forward to presenting and getting your feedback. So without that, I'm gonna stop talking, and thank you for having all of us here. And again, there's a lot of extra people we didn't name, but a lot of work has gone into this. And I love the sneakers in the back. All right, I'm going.
I was thinking the same.
Thank you.
I just had to say that. All right, we're back on schedule again.
All right, good afternoon, everyone. My name is Kelvin Moore. I'm happy to be here with my partner, Seema Shaw Nelson, who will be presenting you tonight around our proposed revisions to our board policy for JICJ, which in other words is our portable electronic communication devices. So we are excited to be here with you tonight to share with you what we're currently doing as far as our pilot and our rationale for why we're revising the policy and putting some things in place. So in short, we know that this policy is very important because one of the things that we are noting is that we understand that there are some positive impacts of us limiting cell phone usage of our students while at school. And so we know that those positive impacts impact their learning and impacts their social emotional well-being. And so we know that there are positive impacts around how it helps students focus and how it's a more efficient use of their time, their engagement and face-to-face interactions with each other. And we also know that it creates climates and schools where discipline problems are reduced and we're seeing less conflicts between students. So we also know that there are impacts of social media on our students' social emotional well-being. We know that it can contribute to things such as depression, anxiety, low self-esteem, suicidal ideation, self-harm. And we also know it impacts our overall school climate with everything from cyberbullying to how fights and violence may be exacerbated or instigated on social media, as well as we know that we went through a season where a lot of things were, a lot of pranks and et cetera were also noted and spread on social media that were occurring in schools. And so we know that there are direct impacts of social media on our students' social emotional well-being.
Hi, everybody. I am Seema Shaw Nelson. I am a special assistant to the CEO for City Schools and the proud parent of 2 lifelong City Schools students. So this past August, Dr. Santelises challenged leaders to pilot cell phone free school policies at their schools. So we are trying to be very intentional about learning from our schools and our school communities about what is effective, what is impactful, what are best practices that we can reflect in our district-wide policy. So you'll see some of those best practices kind of peppered throughout the presentation. So as a brief overview, there are 25 pilot schools. Most are elementary middle. There are 6 high schools. We have all but one of our high schools have at least partially implemented their policy, and each school has designed their own policy and practice. So some are using Yonder pouches. Those are those pouches that lock that kids put their phones in and then carry with them throughout the school day. And then they get unlocked at the end of the day. A few have incorporated certain times and places where cell phone use is allowed. The majority of schools are using either a classroom collection system or a central collection system. So like a classroom collection system where the teacher is collecting phones and collecting phones from kids and securing the phones for them. And a central collection system where phones are collected in a central location and secured there. So as part of our mid-year reporting, we have asked staff and students at the pilot schools to complete surveys about how they are experiencing their school cell phone free policy. So we received 200 responses from staff members at 20 of the pilot schools. And this is what they're saying about how they think students are impacting. And you'll see that it's overwhelmingly positive responses. About half think that students' mental health has improved. 75% see an increase in student focus. Many are seeing better academic performances, and 67% also say that there's less conflict between students. And of course, staff are also impacted themselves. So this is what really exciting to me. A large majority, 76 and 70% are seeing fewer conflicts with students. and better relationships with students. And most importantly, and I think most profoundly, they're experiencing these changes with improved mental health and improved job satisfaction. And we knew going into this that teachers would be impacted. But honestly, I'm really just blown away by how impactful it's been on teachers and how they're experiencing the classroom. And of course, we've been surveying students as well. We have now received 1,049 responses from 18 pilot schools. And to be transparent, 62% of students have concerns about the policy. But you'll see here that the majority of students are experiencing positive change this year, both in academics, with focusing more, improved grades, learning, and in wellness. So which we know is like really critical, especially right now in this environment. They're interacting with each other more. They say there's less drama and fighting, and like staff, they're also experiencing improved, better mental health. And of course, I'm sorry, grade level of students that were surveyed. That's a great question. It was all of the students that were impacted that the principals thought were that were impacted by the policy in the schools. So there was mostly like some fifth grade, but mostly 6th through 8 and the 9th through 12. And then, of course, we reached out to parents and caregivers, and again, of those 6th through 9th and 9th through 12th grade students at the 25 pilot schools. We gave them a 2-question pocket poll, which was pushed out via text. The first question was about how parents felt their students had changed since the pilot had started. And 20% of parents said that their kids talk to them more about their school day. I, for one, would be really psyched if my kids were going to talk to me more about their school day. So I thought that was very exciting and encouraging. And then we also asked parents what were the most important aspects of a cell phone policy that they wanted to see us to be sure were included in a district-wide policy. And that was, of course, school-wide safety and concerns around emergencies. So we've really tried to be very deliberate and intentional about how we're thinking through those systems. So I will pass it over to Deputy Chief Calvin Moore, who will be talking more about the proposed revisions and how we've addressed the emergency concerns and other concerns, as well as how the best practices from the pilot schools are reflected in our policy recommendations.
Thank you, Seema. So as you all know, we have in our current policy a definition for devices, and that is pretty simply anything that can be worn or transport or receive, record, image, or send images or text. And what we know is that it is important to kind of align this with what we know our students use more than just a cell phone, right? And so we are expanding the definition in our proposal to include laptops, tablets, wireless headphones, geolocation devices, and smartwatches. This does not include, though, any location tracking that may be provided, and it also does not include the laptops or other devices that are issued by us city schools. And one of the things that we're noting with this is that our pilot schools report more positive results when schools restrict the use of all devices. So in some cases, our students may come into the classrooms with their headphones on or et cetera, but where there is in our pilot, we're noting that where all these devices are restricted, we're seeing more positive results. So in our current policy, we note that students must have their devices powered off and in silent mode, and they should be stored in a locker, a backpack, or a purse. And one of the things that we're proposing is that it should be powered off, away, and secured. And that's, again, powered off, away, and secured. And so I'll get into a little bit more about what secured means in just a second, as we have some options for that. But I want to note that our pilot schools are reporting, again, more positive results where they are seeing clear expectations set around how phones are off, away, and secured, and also where we have very clear consequences aligned to students who may be outside of that parameter. So as we're defining secured, I first want to note that we know and we understand that we want to make sure that we have consistency across the board. And so as a result, we have determined that in our schools that are pre-K 8, that our default that we recommend for them is a central collection. And our schools that are 9 through 12, we're denoting that they should have a default of student lockers. But we are giving schools the opportunity that as I go through these 5 options, they can use any one of these 5 options to let a request go to the school's office to have a waiver, so to speak, around using one of these alternative ways in which they will secure their student devices. So we provided 5 different areas for which we believe that schools can provide and live up to the definition of secured. And that could be in option A, that the devices for that school is placed in a student locker. Option B would be a specifically designated device locker. Option C would be a device pouch. So similar to if you've ever been to an event like a game, not game, but a concert, and you walk in and they have you put it in your yonder pouch and it's locked and secure. That would be a device pouch option. Option D is around having the devices collected by the classroom teacher and stored in a locked cabinet in the classroom. And option E would be around the devices being centrally collected upon the student's arrival into the school and placed in a locker or a cabinet room. So for example, in one of our pilot schools, Vivian T. Thomas, when students come in, they have device lockers. As soon as they come in, they get to place their cell phone or other equipment, electronic devices in that device locker, and then they have access to that device locker at the end of the day. So we know that use during the school day is currently listed in our policy as pre-K 8 students have an opportunity to use their portable electronic communication devices for incentive purposes, and that in grades 9 through 12 that they can use the devices during lunch. And in our proposal of everything being powered off, away, and secure, it would apply from bell to bell. And that would include lunch, recess, passing periods. And we also note that for school-sponsored events that may be outside of the normal school day, that students must keep their phones off and away during that time. And schools cannot permit students to use their devices as an incentive. We note that in our pilot schools where we're seeing the most positive results is when this device restriction is implemented throughout the entire school day for the entire building. And we're seeing more positive results. And even you'll see here, one of our students noted in our feedback that I've been able to focus more on my grades, I've been able to focus more and my grades have improved. And that is when we get into our feedback, you'll see a lot of the feedback that we're getting from our students and staff and school leaders and our pilots and even our families and our pilots around some of the feedback that aligns directly to the shifts that we're making in the policy. So use for instructional purposes. Currently, our policy states that students can use their device when specifically permitted by a teacher for instructional purposes. However, in our proposal, we're stating that whenever possible, city schools issue technology should be what is used. All of our schools should be equipped to be one-to-one, and we're saying that because we know that those devices have pre-approved instructional applications and platforms from our academics office, that should be what is used. However, we are saying that teachers must receive principal approval for each time for an instructional purpose that they want to allow students to use their cellular or portable electronic communication devices. They can inquire and get approval from their principal for each time that they want to use those devices. So use during an emergency. So we know that it is what goes without saying that we know that students' use of cellular devices during an emergency can create and contribute to the spread of misinformation. It can interfere with communication and directions, and it can disrupt during such times as a lockdown. And one of the things that we want to make sure that we're explicit about in this proposal is that students cannot use their devices during a school emergency unless permission has been given by a school administrator or by a central office team member that may be responding to some type of incident response at that school. And we also are noting that schools must have a plan for notifying families in the event of a school emergency, and this plan must be communicated to families in advance. And you'll see later on some of the ways in which we are also expecting communication and how communication is being shared. But I will note that this proposed revision is consistent with the recommendation of safety experts. And so as we are retooling in real time, one of the things that we're keeping a pulse on is what other districts are doing, but also what safety experts are saying as best practices around some of the components of our pilot that we are providing an extended proposal around how it should be handled. And in this case, for our emergencies, we know that safety experts directly align to the language that we're using. So communication during the student day. Currently, our policy really doesn't address this, but we have outlined that we know that communication is important. So therefore, we are wanting to make sure that students will be given reasonable access to the devices or to a school phone if they have a legitimate concern or urgent personal need that they need to share with their caregiver. And we also note that if parents or guardians who need to be in contact with their student, they should be able to contact the school. And because of that, we want to make sure that schools have a plan in place for making sure that that two-way communication exists, right? So that phone calls from parent or guardians can be received and that information can be relayed, as well as students being able to have a designated protocol in place for how they can communicate back with their parents if they need to. This plan should not rely on the use of staff personal cell phones. So all schools have phones, and we expect there to be a plan in place for how this will be carried out. So staff cell phones, currently our policy doesn't address explicitly the use of staff cell phones, but we know that staff are models. And so as we expect our staff to model, we know that they should not be using their personal electronic communication devices for personal use during instructional time or during times that they are supervising or chaperoning with students. It is important for us to make sure that, again, that they are modeling and that their personal use of their devices does not occur during those times. So implementation. So as I stated before, we want to make sure that a few things, and one of them includes making sure that we have clear disciplinary consequences, including the confiscation of devices that is aligned to our student code of conduct. And that we also know that as we communicate our guardrails and our information about how this policy will be rolled out, it will be shared in our family guide and in our student rights and responsibility handbook. We also know that schools are going to receive guidance on how to implement the policy with fidelity, including basically a toolkit to walk them through and support them with techniques on de-escalating student interactions that may be involving students who are resisting to having their devices secured, best practices for communicating expectations to students and families, and for their and instruction on how to engage with students and families around our digital citizenship. So special considerations are noted in our proposal, and that includes for our students that we know that may be receiving IEP Section 504 accommodations and that may be multilingual learners that require translation needs. And so that will be embedded in our policy, as well as if a student needs access to the device to monitor a health condition, this need must be documented in the student's IEP, Section 504, or their individual health plan. And that assistive technology that can be controlled remotely may be used, but it will require a parent or guardian to sign an agreement. So stakeholder engagement. So we've done a lot of work with collecting information and feedback, and we know that that collection of information is required, right? Because this is a policy that has a large impact. And we understand that gathering feedback from a wide variety of stakeholders is important. We also note that we started this process back in 23-24 school year, and we have been receiving and engaging in engagement and feedback sessions since then. And that this engagement process also includes the information that we are getting from our pilot schools, our families, our teachers, and school leaders who are helping inform this and that are living this during the pilot. So some of the engagement that we have engaged in so far has been around a number of different stakeholder groups. And so we've engaged with our ASCBC groups, our student board. We had a student board forum that was a wonderful turnout. We've been engaging with our Baltimore Teachers Union, PTAs, and Pizzazza, as well as our interaction with you all tonight. Of that, what is really good to note is that, we received 64 responses on policy feedback that was submitted directly to the board. And we also have had over 300 responses from primarily parents on Facebook. And we are always seeking ways to continue to get more information from our parents, as well as you probably heard Seema talk about us doing a POSIT poll and et cetera. And that is all that we have. Any questions?
And/or feedback.
Hey, this is Corey. Normally I would have like a lot of questions, but this presentation was very thorough. It hit on everything. I was going to ask about the consequences if a student didn't turn in their cell phone, and it was clearly stated confiscation. So everything was this is my parent approval. So thank you.
We got a question coming in from our YouTube stream. Someone asks, do schools have a public record of the most recent test of the plan? So I think they're asking about the pilot, if y'all wanted to talk a little bit more about that.
Sure, I can talk. I'm happy to talk more about the pilot. I'm not clear on exactly the question. So if there is some clarifications that can be offered, that would be fantastic. Otherwise, I can just tell you a little bit more about how we are going about it. We have, we're meeting with our principals and their points of contact monthly. We have monthly check-ins, the kind of communities of practice, where folks are able to sort of talk to each other and talk to us also about what kind of barriers there are, what kind of considerations there are, what they are learning. And we consistently ask them, like, what are two of the biggest lessons that you've learned since we've last met, right? So like those are the kinds of things that are kind of informing what our best practices are. We are doing site visits. We've been to every school. When we're at the school, we talk to stakeholders, we talk to kids, we talk to teachers. We're there during the school day, so we don't really get to see parents very often, but we also get a chance to see support staff and also just kind of see how things are going, and help school leaders with any kind of troubleshooting that they may need. So we have all of these various forms, and we're documenting all of that. So there's all these various ways in which we are continuing to collect data and look at that data to make sure that what we are proposing is informed by evidence.
To answer the question about what happens, let me go back in the chat so I can get it exactly right. How do you handle those parents that I'm assuming that this is like still don't agree with the policy? And some of the lessons that we've learned from our pilot schools is making sure that they roll it out to the parents first and make sure that they understand the why. And, so not they haven't given this presentation, but really making parents understand like the benefits and, some of the things like the pros and the cons. And what we've found and what we have heard is that the schools have not really received any pushback from the parents. The parents understand it. And, ultimately, like, even though students want their phone, they said they want their phones, but they understand that this is actually ends up being a positive win for them. So we have met with some other groups, and one of the suggestions is to have the principals of the pilot schools meet with other principals across the city when we have our district principal meetings, and have a panel where they can share like their best practices and strategies and things that have worked and was successful in your schools. So they're really excited about that. We're excited to be able to provide that platform for them to do that. And we are hopeful that, it will go well. But again, we are open to all feedback. And if there's some suggestions for how we should engage with parents that are not in agreement with this policy, we're more than willing to hear that feedback and on some ways of how we could interact with them.
Absolutely. I think, I just want to add on, like, something that we're seeing at a couple of the pilot schools, especially the high schools, where parents have been less comfortable with the cell phone policy, is that they're actually like taking the time to reach out to school leaders. And school leaders are saying that now, and in high school, right? And like in high school, it's really difficult for to engage with high school parents, much more difficult than it is with elementary. And those high school principals are saying that they actually have an opportunity now to know parents better and to be able to build trust with parents, because all of the communication is coming through the central office. So there is that those connections and those relationships that are being built, which honestly was a surprising byproduct, but a great one, a great one.
Seema, this is Jonathan. There was one question in the chat too about the survey. They wanted to know what grade level of students were surveyed.
Sure. So the school leaders pushed out the survey to their staff, to their students, and they would have sent it out to students who their policy has impacted. So usually it's 6th through 8th or 9th through 12th, some 5th grade, but mostly not.
Quick question as a follow-up to what was shared on YouTube. Can y'all talk about the emergency communication system? So if I remember from the slides that y'all shared, that school principals or school leadership would have to develop a plan for how they're communicating with parents for an emergency. Can y'all talk a little bit more about has that been tested at all through the pilot, and any like data or anything that we can share with families about that using this during like emergencies? So that's a big one that popped up.
They do the
Thanks,
robocall.
Shantae. That was my question too.
Yeah.
I can jump in. Simi, you want go?
No, I was just going to suggest that you jump in, actually. I think
Okay. So I think one of the things that we are learning from the pilot is, again, being clear about our communications and being consistent about how we're engaging people on the front end supports us with all aspects of the cell phone, limiting cell phone usage. And in particular around this, I think where school leaders have been able to clearly identify like what's the protocol in place for our school building for how we will have communication shared and delivered and et cetera. And the clearer that is, that we're seeing, again, positive results in our pilot around it. Of course, yes, I'm sure that there's some angst on the surface around parents being able to access and get information, but we're looking at also behind the scenes multiple ways of making sure that like communication during an emergency exists. So we have a number of other things kind of going along at the same time with the cell phone policy, whereby we're looking at ways in which we communicate just regular incidents in schools and making sure that that communication is shared out. But as it comes to like being very localized for a parent to call a school and for their message to be delivered to their child, we're expecting school leaders to make sure that they have a clear plan in place and that is shared with parents in advance. And so, and shared not just in advance, but ongoing, right? And so also students are very clear. So I think I was at a school, I can't even think of the name of the school. where was I? I was somewhere where a student was like, "Hey, I need to reach out to my mom," and she's like, "But I was trying to see if I could use the phone in the main office. I know I'm supposed to use the one in the guidance office, right?" So like that plan had been communicated, and it was clear, and that student knew where they could go to make sure that they communicate their message home.
I have a
Also, we've
follow-up.
met with BTU and we have a follow-up meeting with them. So it was pretty positive. Teachers seem to be in agreement with not having cell phones in classroom. And one of the things to Deputy Chief Moore, like if technology is working and available, then we don't expect for people to say use your cell phones. Like, before, we where all of the students had laptops. That may have been the case, but our expectation is that students have laptops that are available so they can use those instead of using their cell phones. And that's why they put it in the policy, not even to use them for like incentives. And one of the other concerns that teachers just want to know, like they don't want to have to be the disciplinarian when it comes to like if a child doesn't want to give away a phone, like what happens next. So that's what we're working with our Office of Student Conduct on, and then also making sure that administrators are clear. But we've met with the Pizzazza as well too, and those were some of the concerns that they surfaced. So we want to make sure that we're being really clear, and that when this does roll out, that everyone has a clear understanding of the why and how we're going to do it. And another offline thing is just making sure, like taking an inventory of what schools need additional like phones. Are they working? Because that's going to be a part of the plan for how people communicate. So whether it be the PA system or everyone having a telephone in their classroom, that's something at each school based off of, what their school model looks like and has, that will be a determinant, but it will be clearly outlined before it rolls out.
I have a question about the communication to the parents. So it says that the schools must have a plan for notifying the families in the event of an emergency.
Mhm.
So I have a student, a son who's at Poly. When a message comes in, it says Baltimore City Schools messaging, or it'll have like a 4 or 5 digit number. So I encountered, and I was talking to some of the PCAB members offline about this. One of the parents where I volunteer at a middle school, she got a notice that there was a lockdown at a school. The problem is she has 4 different loved ones in 3 schools. So she didn't know which school was having an issue. She didn't know which school she needed to try to get somebody to see, what the emergency was, if they were letting the kids out, because it just came through as, I think she said Baltimore City messaging. So she didn't know which school or which one of the kids was affected.
No, she ain't listen to it all. It always says what school.
Well, I'll just say thank you for that feedback. And maybe when we are sending out robocalls, sometimes like if the school is unable to send out a call, or sometimes they may ask for some assistance to get a call, just to make sure that the messaging has the school's name identified, just to double check. So
Okay.
that is normally our procedure, but just to be certain that that's happening.
Yeah.
Okay.
I'll follow up on that, but I think to Mr. Corey's response, I think typically it will list the school somewhere in the messaging. I think it's towards the end or when it repeats. But we will follow up on that. But also to add to that, one of the things that we are working on is what that communication will look like through some of the other platforms that we're also are looking at during this time as well. So we're looking at adding some stuff to strengthen that as well.
Okay. Thank you.
Mhm.
Calvin and Stacy, this is Jonathan. There was another question in the chat. Has there been any pushback from middle or high school teachers that want to have students use their cell phones for classroom activity?
So I actually will, I think Seba could probably speak to that, but I can say that from the meetings that we've been to, actually it's the direct opposite. So no, I would say no, but Sema, I don't know if there's any thing that we've gathered in the pilot that that particular band may have said anything, but no, I would say the
No.
answer to that one is no.
Yeah, we haven't received that pushback. We've also been, working with our academics team, to ensure that like anything that a kid needs to do, like really needs to do academically on a phone is doable on our laptops, on our devices. So yeah, we haven't really heard that at all. And in fact, I think teachers are kind of glad that they don't have to use the cell phones to do things, because then once you have a kid has a cell phone out, then like all the other things start happening with the cell phone.
Keep it coming, you guys. If you don't have anything now and you think of something later, I see Seema has put her email address in the chat. Feel free to give us some feedback. We want to make sure that we have one of the most sh- aligned, coherent policies when we roll this out, and we want to make sure that we are doing what is best for students and what is really allowing us to make sure that our students can be successful. So if you can think of anything, if you have any other questions, you can feel free to reach out to us. Any one of us will respond. While Seema did list her email address there, it could be directed to any one of us, and any one of us will be happy to respond.
Yeah, I can make sure that everyone, the whole team gets the
Yep.
communication. Absolutely.
I agree with the policy, and I did listen to it during the Board of Commissioners policy
Great.
meeting. And I heard from two of the principals where it's piloted at, and they had really good feedback. And, and I even asked Jason about it, like, how does it work at his school? Did it take a lot of time to collect all those phones at the beginning of the school year? I mean, at the beginning of the school day. So I really think it'll work. And actually, it's getting to kids because I'm volunteer at Mount Royal.
Mhm.
So one of the I pulled my phone out because I'm a mentor, and I pulled my phone out for something, and this little girl said, "You're violating the policy. You're not supposed to have your phone." I'm like, "What?" And then it dawned on me. I was like, "Oh, she knows about the policy that's going into effect." And some of the kids, because they're in eighth grade, I'll help with high school choice. So someone was like, "I'm not going to that school because they can't have their phones." So they know, even in eighth grade, they know it's out there. And it was just funny that she was like, "You're violating the policy by having your phone out, Miss Faison." I'm like, "I'm helping you."
Miss Faison, please don't violate the policy in front of the babies. So we appreciate you, though.
Like, I'm a volunteer. I'm helping you out.
We appreciate you though, and it's good to know that our kids, like, one of the things that we look for, just even as educators, is for our babies to be able to articulate the why and their understanding of things, right? And so it is important to me for you to have shared that, because it lets me know that the information that is being shared at that school is really not just about the restriction, but connecting it to the why.
Yeah, she caught me so off guard.
All right, well, there is nothing else. I want to thank y'all for taking the time to walk us through what those proposed changes were. For those tuning in on YouTube and then on our Zoom, we're going to be sharing the slides out on our website. So if you came in towards the end or whatever it was, you'll be able to kind of take a look yourself. There is also in the chat a link to provide any feedback on this particular policy. So that's also available as well if you have any more thoughts to share with the team. So thank y'all so much.
Thank you for having us.
Thank you for having us here.
Thank you all so much.
Thank you. Have a good evening.
Thank you.
Have a good evening.
Easy. All right, and so just to wrap up our night, I'm gonna share my screen real quick. One second. All right, so I just had one announcement. It's around our spring PCAB public meeting with Dr. Santelises. So as you all know, we had a fall meeting with Dr. Santelises, and now in the spring, we will have one as well, and that will be on Thursday, May 15th at 6:30. As we did in the fall, we want to follow a similar protocol where PCAB will be gathering questions from the community between now and March 21st. That's a Friday. And so the questions can be submitted from both the public input survey as well as PCAB board members will be submitting questions as well. Our target is between 13 and 15 questions. I think last time we got maybe close to 30 questions, and we was able to meet as a board and kind of, dwindle that down and combine topics and things like that so that those were covered in the meeting. Some of those topics that will be covered will range from budget, family and communication, family and community engagement, policy, communications in general, teaching and learning, school safety, special education services, et cetera. And so again, the public input survey will always continue to be open, but specifically for those questions for Dr. Santelises, we updated it for our spring meeting so you can submit questions there. And board members will vote on questions that were submitted between March 26th and April 2nd. So again, I threw out a lot of dates there. So our spring public meeting with Dr. Santelises is on Thursday, May 15th at 6:30. You have until March 21st to submit questions, and you can submit questions through our public input survey. If anyone on the exec board or anybody can add the link in the chat, that would be super helpful. Um, and then the board members will vote on which questions between 13 to 15 questions that will include in that meeting for Dr. Santelises between March 26th and April 2nd. And then we'll submit our final list of questions by close of business on April 3rd. Our next public meeting will be next month, March 20th at 6:30. Our focus is on mental health from our public input survey. That's a lot of feedback that we got is that parents want a little bit more information on mental health services. And so that's what we're providing in our next public meeting. So we'll have a presentation from City Schools Whole Child Services and Support Team. Then we'll also have a presentation from NAMI Baltimore. NAMI is the National Alliance on Mental Health Illness. Upcoming PCAB committee meeting. So the the policy committee meets February 24th at 6 p.m. and they meet every fourth Monday of the month. Teaching and Learning Committee is set to meet February 27th at 7 p.m. and they meet the last Thursday of every month. And then the budget committee is set to meet in March on March 5th at 6 p.m. Before I adjourn, I just wanted to know if any board members had anything that they wanted to share out before we end for the night. Any events happening at schools, any good news, anything like that we want to share with the public before we end it off?
This is Marvin. Patterson Park Public Charter School next week on Friday, the 28th at 5 p.m. My school is having a Black History presentation. So y'all welcome to come, or anybody in public if y'all want to. It's a community school, so y'all can come through if y'all like.
Anybody else? All right, if there is nothing else, then thank you all for joining us tonight. I think there was some, really valuable information that was shared, and some clarity on that cell phone policy was very important. As always, stay connected with PCAB on YouTube, Facebook, Instagram, all the social medias. And if you're interested in joining the PCAB committee, our website is here, tinyurl.com/join the PCAB committee. Again, thank y'all for joining us, and we'll see you all next month.
Thank you. Good night, everyone.
Good night.